Not everybody gets the trifecta. As hard as we try to achieve the trifecta, there are so many factors involved. What type of tumour you had, what your potency was like beforehand, what your waterworks were like beforehand. So not everybody gets the perfect outcome. With regard to these, there are three things that can happen that need to be addressed. The first one is cancer control. With regard to cancer control, obviously, if your cancer was contained at the time of surgery, if the margins were clear, and if the PSA is undetectable at the 6-month mark, things are looking very optimistic and you're very likely to be cured. Having said that, if your cancer was more aggressive, if the margins were potentially positive, or if the PSA was starting to trend up or never completely went to zero, then there's a possibility that the cancer could come back over the ensuing years. What we do in this situation is we monitor the PSA. If the PSA rises very slowly, this would more suggest problems locally where the prostate bed used to be. And it's possible that even at the time of surgery, there were some microscopic cells beyond where the prostate sits, and they can declare themselves over the ensuing years. These can still be eradicated by radiotherapy, particularly if it's treated before the PSA gets to 0.4. And so it's important to monitor the PSA every 6 months for the first 2 years and every year afterwards, at least for the next 10 to 15 years. This is particularly useful with more aggressive cancers.